Welcome to what I'm describing, reflections from pharmacy leaders advancing the pharmacy profession. It's my pleasure to have with us here today Dr. Barbara Brandt, who is internationally recognized as a leader in interprofessional education. She is an Associate Vice President of Academic Health Center at the University of Minnesota and also a professor in the school pharmacy. She's also the director of the Nexus, which is the National Center for Interprofessional Practice and Education. So it's my pleasure to welcome Dr. Brandt.
Thank you.
Thank you. All right. So we'll start off with, we'd like to learn more about your journey in your career and recognition as a leader, because you are recognized as a leader in your area. And in that response, you may want to reflect on key events that shape that or key persons that influence you in your journey.
Okay, well, let me start out by, first of all, thanking you for this opportunity to reflect. And I will start my journey at the University of Illinois, where I did my PhD work. And I am not a clinician. My PhD is in continuing education for the health professions. And I always worked with medical education and nursing education. And so in the early 90s, I was actually recruited to the University of Kentucky in pharmacy. And I'd never worked with a pharmacist before. My uncle was a pharmacist, but I'd never worked with a pharmacist. And so I took a leap of faith, and my background is I studied the cognitive psychology of learning. So I learned about how people can reframe their thinking, new strategies for learning. And what happened is it ended up being very important while I was in University of Kentucky, because that was the decade that pharmacy had made the commitment from going from a drug product focus to a clinical focus. It was perfect for me because that's the kind of thing that I studied. So the dean at the time was Jordan Cohen. He is a huge mentor of mine, visionary, and he was the driver of the PharmD, all PharmD or entry-level PharmD program at the time. And I had many mentors, like Bill Labawi was my associate dean. He would allow me to be very creative, but I always gave him the messages because I knew it was important for a pharmacist to deliver some of the change messages that we're actually advocating for. So we developed a very, very innovative curriculum at the time. The other part about the University of Kentucky relative to history is that was where Paul Parker was a faculty member, the visionary for the All PharmD. So I was with people like Bob Rapp, who was one of the first PharmDs, Bob Bluen. I worked with Tom Foster. So early PharmDs who their education was with the medical students. So they were making a profession up at the time. So for me to be around that stature of those PharmDs at the time, you know, carrying on that the profession needed to change. And trust me, it was not an easy conversation to have during the 90s. Going to the All PharmD, I was in the middle of that. And so for me, I never had a plan in my career. It was just seizing opportunity where my academic preparation aligned very nicely with pharmacy. The other strand that, because I was at Kentucky, that many people don't know about me is that I actually was a consultant during that era to HRSA, Health Resources Services Administration, via pharmacists and government. So I worked on amazing projects with a full array of interprofessional, and the one I'll mention for the sake of history was the 340B program. I was brought in the 340B program is a drug pricing program for disproportionate share hospitals, FQHCs, and the like. And what people don't know was that it was one paragraph in another legislation, and that paragraph was 340B. people had no idea what to do with that paragraph, and no one in the government wanted it, but they needed to act on it. And I was given an award to conduct research about and make recommendations for policies. And I advocated for pharmacists in the federal government. There was no office for pharmacy. It became the Office of Pharmacy Affairs. I coined with colleagues the phrase pharmacophobia, because at the time, FQHCs, they were seeing patients, they could see a physician, but they couldn't pay for their medications. So why diagnose somebody with hypertension if they can't afford their meds? So that became the underpinning for my interprofessional career. So I'll leave it at that. And I'm very, very passionate about pharmacy. I developed teaching sites in Eastern Kentucky, the hollers of Eastern Kentucky and the like, and lots of innovation.
Wonderful. Okay, great. And you'll probably make more comments about your journey at Minnesota as well.
Mm-hmm.
Very good. Thank you. I did not know that, by the way. Thank you.
I know a lot of people, I need to write it up. A lot of people.
Exactly. So my next question has to be, what do you see will be your legacy in 20 years? So in other words, reflecting on your contribution, what are you most proud of in terms of your contribution that really has helped advance the pharmacy profession? And there's a lot of things, but.
My entire career, even in my graduate program, I was trained to think of systems, and which I mean that I often can see things happening 20 years ahead of time. And that's what I saw for pharmacy. It can be a very frustrating place to be. So a lot of my advocacy work in the federal government, I could see the potential of pharmacy when a lot of times pharmacists couldn't see the potential. And so I did a lot of advocacy. And I would say my work at Minnesota now and nationally is focused on the interprofessional team, so therefore the pharmacists within that team. And I served on ACPE, the Accreditation Council, and helped to write the first sentence in the standards for a requirement. It's now way over what I thought it would be in the future. So my legacy, truly, I hope, is this concept of, you alluded to it, the nexus, that we need to redesign education. Teams are here. We have to value the contribution of all the team members, even beyond the health team. So I definitely want to be known for my work on pushing the envelope 20 years ahead. So, yeah.
Absolutely. Thank you very much. I really appreciate that. So the next question, and you can give as much advice as you want, is advice for students in their professional journey as they develop as leaders to help advance the profession.
Yeah. So because I'm not a clinician, I had a little bit of an advantage, really. A lot of times people look at me and go, well, you're not a clinician, how would you know? But I actually had a position for 6 years in a clinical environment, so I do know. I worked in the culture of clinical care. But I think because I didn't have to go through some of the standard ladders, my mind was always open. So for people who have to go through, accreditation and licensure, all that sort of thing, my major advice is do not let that hinder your mind, that always to keep an open mind, and then you will be able to seize the opportunities when they happen. But if you have a narrow world view, it's hard to really take advantage of them. And so I would say that's been probably the characteristic of my career. Like, I'm sensing things during this COVID pandemic. I'm sensing the opportunities for change of things we've been fighting for decades. So that's my worldview, is how can you turn issues or crises into a positive. The other thing I would say is, you have to be very sensitive to your environment while still taking risks. And so I study the literature on complexity of systems and developmental evaluations. And sometimes some of the biggest impacts we have start with little notions. And so, sometimes, just taking a step in a little way over time will have big impact. So I would, those are keeping an open mind, seizing opportunity, trying innovation when it doesn't seem to be the norm.
Very good. Excellent. Excellent words of advice. So that brings us to this final question I have. Obviously, it's a history class. We're learning about the development of our profession. But when we study the decade of the 2020s, in that decade, COVID-19 pandemic will be an event that will shape our world, has shaped our world, but will also shape our profession in healthcare and pharmacy. In particular, if you're an optimist, that's an opportunity for the present. I'd like to hear your vision, how you see that when we study this decade.
So I'm actually in the thick of these conversations now, and I'm busier than I ever have been. I actually now live in North Carolina. I didn't even tell you that, Terry. I work
I did know that.
Minnesota, and there's some innovations going on here. They have committed to value-based payments a couple of years ago. And I'm working with the University of North Carolina and Duke on a project they actually had to stop because it was supposedly going to look at, and pharmacists are involved and in family medicine clinics, is we go to value-based payments, which UNC has. They have put 3 of their departments on value-based payments, meaning, outcomes, and, you need to manage to the patient outcome. And a lot of the proposed changes has occurred overnight with COVID. So, relaxing some regulations, working as teams to rise to the occasion, new workflows. And so the whole behaviors of the teams and innovation, we've been trying, and this COVID has stimulated that very, very quickly. We're having to use less resources, figure out how to manage. It's very, very painful. We have adapted telehealth, which has been for decades, has been, advocated for. All of a sudden, people are adjusting to that quite nicely, I might add. So that's what I think the decade of the 2020 is going to be about, is we've had this massive event in the first quarter, second quarter. And we're going to be looking at what the permanent changes are as a result of necessary response to the pandemic.
Very good. Excellent. Thank you very much. I really appreciate your time, Dr. Brandt. And,
thank you. It was nice for me to reflect on my roots.
Yeah, thank you.